Welcome to the Real Talk Show as we continue on the great series of the Road to the RAHi 2024. I'm your host, Linda Monde, and today we have a dynamic duo on the show with us today. Inge Musonda, a proud winner of the Regional Adolescent Health Hero Awards at the RAHi 2023, and Tatenda Songori, the Executive Director of Youth Advocates Zimbabwe, not forgetting our great sign language interpreter, Chansa Shadrach. On today's show, we will explore empowering young people, collaboration, innovation, and many more. So let's dive into this great conversation. So for starters, I have told you that we've got a dynamic duo on the show today. So I'm just going to ask Inge if she could, you being a winner of the Adolescent Health Hero Award, and we would like to know what this award means to you, how it's a resonant to your work and the dedication of your field of adolescent health, and also if you could just briefly share a little experience of your RAHi 2023 and how it has impacted your work and your perspective, Inge.
Hi, everyone. Thank you, Linda, and delighted to be part of the show today. Um, well, I didn't really expect the award last year, but what represents or what it means to me is quite huge because of my career as a clinician. I've had like a dynamic of interests in adolescent health, and having started many adolescent health spaces and health services back where I worked. It really meant something. It was just like a representation of what I do and what I did back then. So it was huge. I was very honored to be awarded Health Hero, and I would just like to dedicate it to the people that took their time to believe in me and to vote and to make me be there. I really appreciate. The RAHi last year was an exciting event. It was a good platform for adolescents to mingle. We had different adolescents from different places, and it was just phenomenal. A big shout to everyone who took part in that initiative, and it should be as big as it was this year. Last year. So thank you so much, Linda, for inviting me to the show. Looking forward to learn more and to share more experience.
That's really great. So while we're still on that, could you share a success story from your work with in adolescent healthcare, including the impactful collaborations and partnerships that you feel may have contributed to you winning the award?
Okay, thank you. Like I said, I've been working with adolescents for more than 5 years now, and being awarded as healthcare hero really meant a lot, and the impact just opened up a lot of other opportunities and successes. One success story being having we deal with different adolescents, those on treatment, those on HIV treatment. Yeah. So having a lot of adolescents come together as treatment support groups, and having seen them doing well on treatment, that's one big huge success on my part. Yeah, because when you have them together, they teach each other these things on how to go about being adherent to their medication and all that. So on the HIV treatment part, that was a very huge success. Yeah, and many more other successes.
That's really great to hear. It's been really an amazing journey, huh? So I wanna learn about the youth advocates. I wanna hear something great. So Tatenda, could you please tell us a bit about your work and your organization, the Youth Advocates, and what role your organization will be playing at the Regional Adolescent Health Indaba 2024?
Thank you very much, Linda. Um, just like you said, my name is Tatenda Songore. I'm the executive director for Youth Advocates. So we have been with RAHi for the past 2 to 3 years, I think, since it started. And our organization, Youth Advocates, is a youth led organization. Uh, that is from our board to our staff and to the people who we work with on the ground. We advance sexual reproductive health and well-being for adolescents, young people, and communities with our program in Zimbabwe reaching approximately nearly a million adolescents and young people, and at regional level we carry out advocacy for adolescents' reproductive health and well-being, with a particular campaign running on age of consent, and also scaling up of our technology-driven interventions, where we are piloting 393 Youth Helpline across 3 countries in the Southern Africa region. So our efforts are anchored to ensure that young people have got the knowledge, skills, opportunities for healthy, productive, and fulfilling lives. And we take pride in reaching over a million young people in East and Southern Africa. And this work is tremendous. And for this year at RAI, we are very excited to be a key strategic partner for the youth platform to mobilize young people to be part of RAI from Zimbabwe, Botswana, Kenya, sorry, Botswana, Namibia, and Malawi. We are going to be mobilizing young people to be joining RAI, and we're very excited with the interest that is coming through from different young people, and we are hoping to meet other young people from the region at RAI 2024. And of course, when young people come together, information, science, and good best practices are shared together. And of course, the opportunity to have fun, network, and share the diversity culture of our region is one of the rich traditions of RAI, and we're excited to be part of this.
Thank you so much. So, while we're still on that, what do you believe are the most pressing issues facing adolescents in the region, and how can the RAHi 2024 help address those challenges and promote positive health outcomes?
So, key amongst the issues is the new HIV infections amongst young people. We have seen evidence showing us that we are still having high new HIV infections amongst adolescent girls and young women. We are almost double that or 3 times that of their boys' counterparts. And that on itself means that we need to reimagine the way and our approach to ensure that there is zero new HIV infections by 2030, and all young people who are on treatment are virally suppressed. We see a lot of young people with high viral loads, and adolescence itself is a critical stage where young people who may be newly infected or young people who are already HIV positive face challenges in adhering to treatment. They have got competing entertainment events that they want to attend to. They've got issues with disclosure. They've got also issues on how they can network with their peers with the understanding that they've got a condition that they have, which is being HIV positive. And what we need to do is to fight stigma, encourage peers to take on their medications religiously, and ensure that they are continuously monitoring their viral load so that they are suppressed. We have got new technology, new um, information that has been discovered that when a young people is undetectable, they cannot transmit HIV, which is a very, very much tremendous opportunity for us to equal or young people who are on treatment to say that when you take your medication well, when you're religiously taking medication, you will not be transmitting HIV, but not encouraging them to be promiscuous or not to take risk behaviors. But this is just science telling us that there is light now at the end of the tunnel, and we've got hope towards an HIV free world. And it begins with every young person who is positive, a young person who's negative to stay negative, and to close the tape on new infections. So the issues that I've just indicated are key in terms of HIV prevention, but we also have got a huge issue in terms of access to HIV and sexual reproductive health services amongst adolescents and young people. We've been seeing a lot of health facilities experiencing limitations in terms of how they offer services to adolescents because of age restrictions to access to services. And as youth advocates are working with the youth platform, we are taking up the conversation on access to sexual reproductive health to RAI and to also other different countries that we are partnering with so that we are able to define what it means to access services with no restrictions for adolescents and young people. The laws in different countries are not the same. In some countries, they say age of access to HIV services is 16. In some countries, they say 18. In some countries, they say 12. But we want to take up the conversation. What does it mean for a young person to access HIV and sexual reproductive health services at a local facility without restrictions? And I'll give you a typical example. In one of the countries where they can only disclose HIV status if a young person is accompanied by a parent or a guardian. What this means is if a parent or a guardian is not there, young people will not be able to access their HIV services freely and even know their HIV status freely in the legal confinements. And what this means is even when it comes to the approach that service providers take, they are more cautious when they are offering services to young people and they want to stay on the right path in terms of the law as far as disclosure and administering of HIV service is concerned. We want to change this so that every young person can be able to access services and healthcare providers can be trusted to be competent to administer services in a competent professional manner in a youth friendly approach that ensures confidentiality, that ensures that appropriate support is offered to young people who are tested HIV positive. So these are the critical conversations that we are also taking to RAI in 2024. And we are excited that when young people come together, they share more than just knowledge and culture, but they bring science and expertise to issues that affect them in their own communities. Thank you.
That's really, really great. I'm excited to attend the RAHi 2024. I don't know about our online audience, but I hope everyone's as excited as I am. So, while we're still on the conversation of the challenges adolescents may face, Inge, with your 5 years experience working with adolescents, could you just tell us what do you believe are the most critical issues adolescents are facing today, and how do you think we can better address these challenges in the healthcare sector?
Okay, thanks, Linda. For starters, I would like to appreciate the work that Tatenda and team are doing. Um, Everything peer-led in adolescence is proving to work out very well. So if we have adolescents stepping in to help their friends or their peers, that's a plus. So that's a great job you're doing out there, and I recommend that you continue and just integrate with many other health facilities. On top of HIV, there are many other things that adolescents are facing right now, and some of them are even like the causes of them acquiring the same HIV. We have drugs now. We have the peer pressure that goes through the social media influence. Um, not We don't only have a negative influence, but yeah, we get positive influence from social media. But some adolescents are pressured by those things they see on the media. Yeah, so we have drug and substance abuse. When someone is using, they're not in the right frame of mind to control themselves, hence they end up doing other things that in turn affects their lifestyle. Yeah, and many other issues that they're facing. So sexual and reproductive health rights are just some things that we should talk about as adults. We should reduce ourselves to the adolescents. If I am an adult, I don't expect an adolescent to behave like myself. I should think in a way that they are thinking and understand them. So as parents, as family, as friends, as the community, we all are gatekeepers out there. So if we don't like interfere in the right manner, the adolescents are going to fear to open up. So they also fear that they have that fear to open up. Like Tatenda had said, they are afraid to seek health services. They are going through that. It's real. I'll say, for instance, I go to the clinic, I find an elderly person, I seek for family planning or condoms or whatever that I need, and they criticize me. So next time I won't go. I'm afraid of accessing those services because I'm looked upon to be promiscuous or something like that. Yeah, so they are going through a lot, and we need to, because it's a very delicate stage in life, we need to understand them in a way that they should be understood. We need to put ourselves there. We need to reduce ourselves to their age, and uh, just step in. Yeah, be there for them and advise. If you have to correct an adolescent, do it in a way that it should be done rightly. Yeah, so they're facing quite a number of issues out there that need to be addressed.
Okay, that's really great to hear. You have quite good some good solutions because what you've said is really true. You find most of the challenges young people are facing is because they fail to go access services, especially in Zambia, because you could go to the hospital and find that the nurse on duty is the deacon at church. So how are you
Yeah.
going to draw the line between professionalism and all that? So what was true on that, Inge, could you also tell us what message do you have for healthcare professional advocates and young people that are empowering adolescents to take ownership of their own health and well-being? What do you have to say to them?
Okay. My message to healthcare providers out there is do the job that they're there for. Like if they're there to provide a service, let them do that. For instance, if I get an adolescent coming to my facility to access something, let me not criticize, let me not look down upon them, let me not talk of age, let me not. Of course, we have to have the right consented age, but we as health professionals will have a way we have to deal with those things and not criticize. Yeah. So my message out there is just love what you do as a healthcare provider, and you do it perfectly. Yeah.
That's great. I hope they've heard. I'll make sure that they hear.
Yeah.
Anyways,
If you love what you do, believe me, if you just put in 100 in what you do, then everything else will fall in place. Yeah.
yeah. Chatenda, what message do you have the a young for the young people attending the Regional Adolescent Health Indaba 2024, and how do you hope the event will inspire them to take action for their health and well-being? And what do you hope will be their takeaway from the event?
Thank you very much, Linda. Um, to every young person attending the RAHi 2024, this is an opportunity for every young person to demonstrate that they have got the capabilities to bring solutions to issues that they face in their lives, and then to bring diverse issues from different communities to talk with evidence, to talk with the passion, to talk with the commitment to make a change. RAI is more than just a place for young people to meet and share ideas and also bring solutions to communities within Southern Africa. It is an opportunity for young people to also demonstrate as professionals in their own field, to demonstrate that they are capable to be counted as solution holders in terms of what challenges they are facing as far as their health and well-being is concerned. We have got issues of mental health, just like our hero has indicated, Enge. I think mental health has become a big issue because of issues around drug and substance abuse, and we are looking for solutions that could help our communities to tackle these issues. And young people, we have got a clear understanding that they can be the solutions to problems that we face as communities, we face as countries, and we are hopeful that at RAI, young people are going to come up strong. Young people are going to demonstrate their capability to be professionals who bring great solutions to challenges facing Africa. We are also very optimistic that the key decision makers who are participating at RAI are going to be listening and also listening. And they are going also to take key recommendations from these young people so that they are taken up in terms of policy, programming, and even investment. We have seen that investments in youth led initiatives has been increasing, but it's not matching the needs that we have within our communities, is not matching the needs that we have as countries. We have seen even issues of skills and jobs going at all time lows, and these issues have got direct impact on the health of the young people, and they've got direct impact on sexual reproductive health. When young people are not gainfully employed, they can take up risk behaviors that can lead to some health pitfalls like teenage pregnancy, child marriages, and if they are not educated as well, we know that the lesser a woman or a girl is educated, the more they are likely to fall into child marriages and fall into the traps of teenage pregnancy. So when we come together at RAI, we are coming to bring these challenges and discuss and show evidence and demonstrate what works and what doesn't, and also proffer solutions that will impactfully change and transform communities from grassroots levels to districts to provinces to national and to regional level. The policy recommendations that will be coming through, we are hopeful that they can also be taken up at regional level, at country level, and we are grateful to the government of Zambia for the commitment that has been made by the Minister of Health to ensure that she will be there at RAI and young people can interact with this highest level of government officials. And what we are hopeful of as well is whatever recommendations that young people bring at RAI are going to be taken up at regional level. I know there's the SADC heads of state meeting coming up sometime in August, being hosted by Zimbabwe. We're hopeful that some of the information that will come from the district level um, Indabas that are going to be taking place and provincial, they can also make their way to the heads of states for discussion and also for possible resolutions. And we are excited to be part of RAHi. Thank you.
All right, great. I almost forgot I've got an online audience. Ish, people, I hope you don't hate me. So we're gonna dive into the comments section and just see what our online audience is saying. So Rebecca Mulenga says it is good to see Inge again after the last try. Inge, you've got fans, huh?
Breaking.
Ellen Mape says she's our mother here in Kitwe and we love you, Mom Inge.
Thank you.
Rebecca Mulenga says we are super excited to be part of the 2024 RAHi. Martina says the discussion is really interesting. Grace says, we thank you, Mr. Sorongor. Yes, sorry for your surname. Let me say Mr. Tatenda for the contribution. It explains a lot about us youths. Eileen says adolescents living with HIV usually face challenges of opening up because of the fear of being discriminated and judged. I'm gonna say your last name. Mukonda says yes, there are many issues affecting adolescents, so we have a big role to play. We have a big role to play in fighting these issues. Martina says, yeah, adolescents really need to be supported and educated about HIV in order to end HIV by 2030. Rebecca Mlenga says, very true. We have a high number of causes that are leading to the high number of HIV infections, of which the main cause is drug abuse because young people are now drawn to high drug abuse, making them not take note of their behavior. It is up to the peer educators to take it up in order to help these adolescents to always keep safe, and the caregivers must heartedly do their work. Nelly says also teenage pregnancy has it's becoming I guess she wanted to say it's becoming worse, and if family planning is not properly distributed, such as condoms, will cause a rise in HIV infections. Okay, I guess that's it from our comments section. Inge, could you tell us your closing remarks?
Um, Thank you everyone that commented. Thank you so much. I would like to end the show by saying, let's find peace in a place where we can express ourselves. What we've created here in Kitwe is spaces that adolescents are free going to access these services. Um, they can access condoms, family planning, they can access uh, prep, they can access many other things. So if we it starts with ourselves. If we feel like we need to seek these services, let's not be afraid. There's one person out there that can help you. You can talk to a friend, you can talk to a healthcare provider, you can talk to family that you're free with, and you can come through at the facilities and you'll find what you're looking for. And there's time for everything. So drugs right now might look cool, but in the long run, you end up just destroying your lives. Let's not listen to our friends. Let's not think it's cool to do drugs in school, to do drugs out of school, to do drugs at home. I mean, what are we rushing for? What are we gaining from that? So yeah, let's just refrain from doing that. And I can't wait to be at RAHi. I'm hoping I'll be there this year. I can't wait to meet the different adolescents with so many innovations, the stakeholders, the policymakers, and everyone out there. So we're coming to advocate, we're coming to communicate, we're coming to mobilize, we're coming to interact, we're coming to have fun. So let's just be there, keep each other healthy, and stay safe. Thank you.
Thank you so much, Ingi. Tatenda, as we wrap up the show, could you tell us what's your key takeaways from the Regional Adolescent Health Indaba 2023 were and your closing remarks?
I think for 2023, we made some great strides in sharing some ideas on what it means to close the tape on new HIV infections. And young people demonstrated their capacity and zeal to be part of the solution. And now, as we move on to 2024 Regional Health Adolescents Indaba, we are calling upon young people to register and to ensure that they are part of the change and we are able to proffer solutions that could be of high impact in terms of being the people that we want to be the change that we want to be. And of course, to every young person who's listening to this, I'm just saying that take charge of your health. You have got the responsibility to make the right decisions now for a better, prosperous future, and always be passionate to learn new things and to explore solutions to challenges that are facing your community. RAHi is a place to be, and make sure that you're registered. Thank you very much.
Thank you so much. It was a great honor to host you guys on today's show. And to our online audience, catch us next week, same time, same place, as we continue our great Road to RAHi series. Thank you so much.